The CDC says it's testing several people in the U.S. to see if they have the deadly coronavirus that's killed 17 people and sickened more than 500 others. One case has been confirmed here in the U.S. Health officials are now calling it the Wuhan coronavirus after the region in China where the virus was first reported. So what do Americans need to know as the illness spreads? Tonight, Wuhan Public Transportation Airport and railway stations are closed until further notice to help slow the spread of the coronavirus. Coronavirus is part of a large family of viruses that can be spread by both animals and people. They can range in severity from the common cold to severe disease.
This novel coronavirus, meaning one that has not been seen before, was attributed to a lot of cases of upper respiratory tract infection. Some pneumonias were reported.
There are a handful of human coronaviruses that are known to be deadly, including Middle East Respiratory Syndrome, or MERS, and severe acute respiratory syndrome, better known as SARS. Symptoms include a runny nose, cough, sore throat, possibly a headache, and maybe a fever, which can last for a couple days. Right now, there are no vaccines to protect against the family of viruses, but the National Institutes of Health in the U.S. are working on one to combat Wuhan coronavirus. Until then, doctors say the best way to protect against the virus is to practice good hygiene.
Cough into a tissue, if not, cough into your sleeve. Good hand hygiene in this regard. Obviously, in terms of if you're feeling not well, don't go to work in this regard, whether or not it's something that's extremely contagious.
And earlier today, officials in Seattle confirmed that at least 16 people had close contact with that patient at Seattle-Tacoma International Airport. While there's no specific treatment, most of the time the symptoms will go away on their own. But if your symptoms feel worse than a common cold, you need to make sure to see a doctor.